Macular degeneration is one of the leading causes of blindness due to distortion of the central vision. So some of the main symptoms that patients with macular degeneration may have are blurriness, waviness, distortion of vision when they look around. It may be very subtle, and therefore it is very important that patients come in and get their eyes checked regularly. There are new treatments for macular degeneration. Therefore, patients who suffer from this disease should know that all is not lost in many cases. But the only way that you could know as to whether or not you require treatment is to come in and get your eyes examined. It's very important for the patients to have a dilated fundus exam, which means we dilate your pupils so we can actually see the retina on a very fine microscopic level. We now have very sophisticated machines that can look at the macula, which is the center of the retina, in very specific and detailed ways, which gives us information and ideas about developing new therapies that may not have been present in the past. There are many anti-neovascular medications that are now available. What does that mean? That means that in macular degeneration, sometimes new blood vessels can form under the retina, and this can cause bleeding and leakage into the retina. And these new medications are very effective in many cases in stopping these new blood vessels from growing and actually causing them to regress, therefore improving people's vision. Unfortunately, we don't have a good way of predicting who may have or who may develop macular degeneration at this time. This is an active area of research. However, we do know that certain lifestyle decisions by patients, such as smoking, can increase your risk for losing vision from macular degeneration. Also, people with a strong family history should really come in and consider getting their eyes checked on a regular basis. Another important issue is that when people tend to get a little bit more senior in age, macular degeneration tends to develop, and the early signs can be present on a routine eye exam, even though the full extent of the disease may not be present in the eye. So therefore, early detection is very important. There are new studies from the Age-Related Eye Disease Study which show that certain vitamins may be beneficial to preventing the progression of macular degeneration. And being that macular degeneration is such a major loss of visual decline and blindness, it is very important that anybody who thinks they may have any of these symptoms of blurriness, distortion, and waviness to come in and see their ophthalmologist as soon as possible.